The underestimated threat of heart disease among the young. In the heart of Columbus, Ohio, Marian Dancy's journey from postpartum exhaustion to a harrowing diagnosis unfolds, shedding light on the underestimated threat of heart disease among younger populations. 6 months following the birth of her fourth child, Dancy, then 35, began experiencing a decline in her physical stamina, marked by an overwhelming sense of fatigue, difficulty breathing, and episodes of temporary blindness. Despite these alarming symptoms, her initial medical consultations offered no concrete answers. Her youth and prior health status led to underestimation of her condition. Repeated visits to healthcare professionals yielded misdiagnoses. Attributing her deteriorating condition to a viral infection and later, pneumonia, after fluid accumulation was detected in her lungs. The prescribed treatments, however, did not alleviate her suffering. It was only upon her fourth emergency visit that the true cause was identified: peripartum cardiomyopathy, a rare and severe form of heart failure occurring towards the end of pregnancy or in the months following childbirth. This diagnosis came as a shock to Dancy, who was unaware that heart disease could afflict someone of her age and apparent health. The revelation underscored a painful reality: her symptoms had been dismissed, partly due to her demographic profile, which did not fit the typical patient with heart disease. This experience highlights a critical gap in awareness and underscores the importance of advocating for one's health. Cardiovascular disease remains the leading cause of death for women in the United States, claiming 1 in 3 lives annually. Heart failure, a condition in which the heart fails to pump blood efficiently, can stem from various underlying issues such as heart attacks, coronary artery disease, and hypertension. Lifestyle factors, including smoking, obesity, poor diet, and physical inactivity, significantly contribute to the risk. Interestingly, peripartum cardiomyopathy occurs relatively infrequently, affecting between 1 in 1,000 and 1 in 4,000 deliveries, with incidences seemingly on the rise. This condition, coupled with risk factors like obesity, poor nutrition, smoking, advanced maternal age, multiple pregnancies, and African American heritage, calls for increased vigilance and education. Alarmingly, recent studies indicate a rise in heart failure cases among the younger demographic, with individuals aged 15 to 44 experiencing an uptick in heart failure-related deaths from 2012 to 2019, especially among Black adults. Despite being a chronic condition, heart failure can be managed through medication, surgical interventions, lifestyle modifications, and, in Dancy's case, the addition of a pacemaker. Following her diagnosis, Dancy embarked on a path to recovery, incorporating a low-sodium diet, exercise tailored to heart health, and stress management techniques into her routine. The supportive therapy provided her with strategies to manage stress effectively and prioritize her well-being. Today, Dancy stands as a beacon of hope and resilience, working with the American Heart Association's Go Red for Women campaign to elevate awareness of heart disease symptoms and preventive measures. Her story is a powerful testament to the unpredictable nature of heart disease and the imperative need for education and self-advocacy in health matters. Dancy's narrative not only highlights the importance of recognizing heart disease signs but also emphasizes that heart disease does not conform to a single stereotype. It is a reminder that heart health is a universal concern, transcending age and prior health status.